Hello friends, in this video we will discuss Rajasthan Mo Radiology questions, and these are PYQs which are taken from last 8 papers starting from 2013 to 2022, and I have also discussed other subjects also, so you can watch those videos also. Let us start with the first question in radiology today. So first question is, which of the following filament is used in X-ray tube for production of X-ray? So this is a direct question. Answer here will be tungsten. So tungsten filament is used for the production of X-ray. Next question. Following energy is used in the ultrasonic examination. So from the name suggests that ultrasound will use ultrasonic waves. So answer will be option number 3, ultrasonic waves. Now, gyromagnetic property of proton is used in the medical field in. So this is again a direct question. The magnetic property is used in MRI, magnetic resonance imaging. So MRI will be the correct answer. Option number B. Next question is string of bead appearance. String of bead is seen in. So intestinal TB, no. Sting sign is seen but not sting of bead. In ulcerative colitis also it is not present. Is in small bowel obstruction, yes, string of bead appearance is seen in small bowel obstruction. And pulmonary TB, no. So answer here will be option number C, which string of bead appearance is seen in the small intestinal obstruction. If we talk about intestinal TB, then string appearance. And in ulcerative colitis, lead pipe. Radio resistant tumor among these are. So we have to talk about two types of tumor, radio resistant and radio sensitive. So if we talk about Ewing sarcoma, then it is a most radio sensitive tumor. And among the given option, most radio resistant tumor is osteosarcoma. Retinoblastoma and nephroblastoma are also radio sensitive, but osteosarcoma is radio resistant. So answer here will be option number B, osteosarcoma. Question is, inferior rib notching is radiology seen in. So inferior rib notching is seen in coarctation of aorta. Answer will be option number A. So if we talk about coarctation of aorta, then some findings in coarctation of aorta is, first is figure of 3 appearance, which is due to dilation of aortic arch. And second one is inferior rib notching. Now if we talk about barium study, then in barium study the inverse of figure 3 appearance will be seen in the esophagus. So these all findings are present in the coarctation of aorta. So next question is, which of the following is true for increasing the kilovoltage peak of a X-ray beam? So more the kilovoltage peak, more will be the penetrability of the X-ray. So answer here will be increase in the penetrability. Calcification on X-ray of the sarcotuberous and sarcospinous ligaments are feature of which of the following conditions? So this is seen in the fluorosis. So this is a direct question. In fluorosis, calcification on the X-ray will be seen for the sarcotuberous and sarcospinous ligament. Answer will be option number A. Which of the following is the SI unit of absorbed radiation dose? So if we talk about the absorbed radiation dose, then it will be gray. Now if we talk about the sievert, then it is for equivalent dose. If we talk about radioactivity, then it is becquerel. For exposure, it is coulombs per kg. Then for absorbed radiation dose it is gray, and for equivalent dose it is sievert. Now if we talk about 1 gray, then 1 gray will equals to 100 rad, and 1 sievert is equals to 100 ram. So this is everything related to the SI units. Next question is, phosphorescent material used in thermoluminescent dosimeter is. So TLD batch is used for the monitoring, and most commonly used is lithium fluoride, and other can be used also. So answer here will be lithium fluoride, but calcium fluoride can also be used, and lithium fluoride is most commonly used. Sign of pneumoperitoneum on supine abdominal radiology are all except. So first option is visualization of both sides of wall. This is true. Visualization of the falciparum ligament. This is falciform ligament. This is also true. Air under dome of diaphragm. So in supine position, air under domes of diaphragm will not be there. For seeing the air under domes of diaphragm, then it should be upright view, upright AP view, or it can be also seen in lateral decubitus position. In air in Morrison pouch, this will be seen in supine position. So answer here will be air under domes of diaphragm will not be seen in supine position. X-ray abdomen is done in standing position to detect. So for detecting X-ray abdomen in standing position is done to detect the intestinal obstruction, because air bubbles can be seen easily. So air bubbles can be seen in standing position. And by the number of the air bubbles we will able to guess that the obstruction, the site of obstruction in intestine. So answer here will be intestinal obstruction. Barium meal study is useful to detect. So if we talk about carcinoma of colon, then in this barium meal follow through is used. For duodenal ulcer, barium meal is good. For colonic diverticula, again barium meal. And for ileocecal junction, then again it will be barium meal follow through. And for colonic diverticula also barium meal follow through. So barium meal will be good for duodenal ulcer. So if we talk about the different barium studies, then barium swallow mainly for esophagus, then barium meal for stomach and duodenum, barium meal follow through for jejunum, ileum, cecum and some part of colon, and barium enema for rectum, sigmoid and colon. So these are all type of barium studies. Next question is intravenous pylography is contraindicated in patient. So intravenous pylography is contraindicated in the patient with renal failure or renal insufficiency, because intravenous the dye which is used in intravenous pylography generally excrete out through renal system, and if there is renal failure then it will increase due to this dye. So answer here will be option number C, renal insufficiency. Because the dye excrete through urine. Now, next question is which of the following investigation does not produce risk of radiation? So, ultrasonography uses ultrasonic waves, so there is no risk of radiation. So, no risk. In barium study and PET-CT and MCU, they will have the risk of radiation. So among the given options, best answer is ultrasonography, which will not have any risk of radiation. While performing abdominal ultrasonography, full bladder is required to see. So generally, while doing the sonography, full bladder is required to see the uterus. So it is generally done for the women to see the uterus. So answer here will be option number D, uterus. Contrast media of choice for myelogram. So for myelogram we have to use water based, non-ionic, iodinated contrast. So for myelogram we have to use water based, non-ionic, iodinated contrast. So among the following, iohexol is the best option. Answer will be option number C, iohexol, because it is water based, non-ionic and iodinated also. Now next question is MRI rooms are shielded completely by continuous sheets of wire mesh of copper and aluminium to shield the imager from external electromagnetic radiations, etc. So it is called as, so this is a direct question, we also study this in 10th class science. It is called as the Faraday cage. So Faraday cage is mainly to protect the external electromagnetic radiations to enter inside the MRI room. Next question is a 20-year-old female come with a mass in the cavernous sinus and 6 cranial nerve palsy. In T2 weighted MRI, hyperintense shadow is present, which shows homogeneous contrast enhancement. So diagnosis is, so here a female is given with cavernous sinus, mass in cavernous sinus with cranial nerve 6 palsy, and in T2 weighted MRI, hyperintense shadow is present, which show homogeneous contrast enhancement. So answer here will be meningioma. Meningioma is the most common primary tumor, primary brain tumor in adults, and it is mostly benign. And in MRI it will show hyper intense shadow and also the finding of samoma body present. So answer here will be meningioma. Next question is all are seen on the right side of cardiac shadow in X-ray chest PA view except. So they are asking mainly about the right border or the right side of the cardiac shadow in X-ray. So superior vena cava will form. This is true. Right atrium of course will form. Ascending aorta, no. Ascending aorta is slightly on left side, and inferior vena cava is again on the right side. So answer here will be option number C, ascending aorta, which is slightly on the left side, so it will not be seen in the right side of cardiac shadow of X-ray. So next question is C1 C2 best seen in. So this is a direct question. For C1 C2 the best view is odontoid view. Investigation of choice for aortic dissection is. So for aortic dissection there are various investigation of choice. Most commonly used is CT scan or CT angiography can be used, but best is MRI. So investigation of choice is MRI, but it can be CT scan also, because most commonly used is CT scan, but best among them is MRI. So according to official answer key, the answer was given as MRI, so we will choose that only. But if MRI is not in the option, then CT scan will be the best answer. All are true about computed tomography. So they are asking about CT. Compare with the plain X-ray, CT uses 10 to 100 times more radiation. This is true. So house field density of water is 0. This is also true. Then house field density of air is 100. No, it is 1000. Then house field density of fat is minus 90 to minus 120. This is true. So answer here will be option number C, because density of air is 1000, not 100. All are true about magnetic resonance imaging except. So T1 image show fat as white or bright signal, whereas water or CSF is dark. So this is true. So if we talk about T1 and T2, then in T1 water is black or dark, and in T2 water is bright or white. On T2 imaging fat is dark and CSF appear white. This is again true. An intravenous contrast agent such as gadolinium is often used in conjunction with MRI. This is also true. So we do gadolinium enhanced MRI in various cases, and calcium appear almost white. No, this is not true. So answer here will be option number D. Calcium will appear dark on MRI. Next question is all are true about ultrasound imaging except. So it uses ionizing radiation. No, first option is wrong. It uses ultrasonic waves which are non-ionizing in nature. It uses high frequency sound waves to make images. This is true. The image is made by sending high frequency sound into the patient and assessing the magnitude and the time of returning echoes. This is also true. Ultrasound imaging can quite dependent on operator set parameters and the field of view within the patient. This is also true. So answer here will be option number 1, which is saying that ultrasound imaging uses the ionizing radiation, which is a false statement. Next question is coffee bean sign on X-ray is diagnostic of. So this is a direct question. It is seen in sigmoid volvulus. So these all questions are related to radiology, and I have covered most of the question. If any question is remaining, then you can ask in the comments, and if you have any doubt, then you can ask in the comments. So most of the question in radiology is direct question or the fact based question. So there is no need to study much for this paper, because in every year only 1 to 2 questions are there for radiology. And if you have any doubt, you can comment below. Thank you so much.